Canada's chief public health officer says influenza cases are rising sharply just as RSV seems to be leveling off. And all of this comes as the supply of children's medicine remains scarce, despite promises from the federal government to get the stock back on the shelves. CBC's Mike Crawley tells us more.
You may feel a bit of a fever, aches or pains for about 2 to 3 days after.
Nahal Nair gets his flu shot every year.
It's a precautionary dose that I'm taking just to be safe.
While he gets vaccinated against flu at this Toronto pharmacy,
levels typically seen.
Federal health officials announced that flu cases are rising at a steep pace.
Steeper than what we've seen in most of any past season that I'm aware of.
Here's what the average Canadian flu season looked like before COVID, and here's what's happened so far this fall. Positive flu tests already hitting levels typically not seen till the peak.
Even though the flu season is just starting,
something else out of the ordinary?
Influenza detections are unusually high among children and teenagers.
Flu can make kids severely ill.
Children are at significant risk, especially since there hasn't been any flu around for the past 2 years.
Hospitals are reporting a sharp rise in the number of children being admitted for flu, even as the impact of another respiratory virus, RSV, shows signs of leveling off. So many sick kids and so little children's pain reliever. Officials promised last Friday that 1 million imported bottles were on the way.
Medications will start appearing on store shelves starting early next week.
Importation has been significantly increased over the last few weeks.
A whole week later?
It's in Canada and is being distributed to pharmacies and will shortly, if not already happening, appear on shelves.
And that's the only formulation that I have received.
Good luck finding any of them right now.
I still haven't received any of the acetaminophen or Tylenol yet, so we're still waiting on that.
A few bottles of children's Advil arrived at this pharmacy yesterday.
I've already sold a couple. I have only 3 or 4 left, so I would say by the end of the day, this should be all done.
To prevent someone from buying too many at once, they're kept behind the counter. Mike Crawley, CBC News, Toronto.
For more on the rise of flu cases across the country, we spoke earlier with Dr. Isaac Bogosh, an infectious disease specialist at Toronto General Hospital, and he explained the possible causes behind the surge we're seeing and how to control it.
Well, it's flu season, but of course we're seeing an earlier rise and a much sharper rise to the burden of influenza in Canada. If we look at the Southern Hemisphere, we often look at the Southern Hemisphere to gauge what our flu season might look like. It was very similar. For example, in Australia, their flu season started earlier and rose very quickly as well. Ours is doing the same. Is this driven because we just don't have the same degree of immunity that we had by missing the prior couple of seasons? Is this other factors where we're making up for lost time? It's not entirely clear. What is clear is that we're seeing a rapid rise in cases, and there are steps we can take to protect ourselves and those around us. And there are steps that we can take to significantly improve the uptake of flu shots. And again, it's akin to what we did with the COVID-19 vaccines. That's targeted communication strategies, it's community engagement, it's lowering barriers to those vaccines as well. If you make those flu shot clinics widely available and bring the vaccine to the people rather than bringing people to the vaccine, you'll see a much better uptake. We need much better uptake this year. You've seen the healthcare system stretched from coast to coast. Obviously, lots of focus on the pediatric healthcare system, but of course the adult healthcare system is not immune to this as well. It's a long flu season ahead, and we know that the vaccine can reduce people's risk of getting the flu, and it not only does it do that, if you have breakthrough cases, it can reduce the severity of symptoms as well. So we need to do a lot more to get better uptake of the flu shot this year in Canada.